Hi everyone, welcome to Clinical Edge. Today's guest is Iqbal Shariff from Best Home Healthcare Network or BHHN, a company focused on delivering home healthcare services and supporting patient care beyond the traditional hospital setting. As healthcare systems continue evolving, we see that home healthcare is becoming an increasingly important part of improving patient outcomes. So let's know more about it from Iqbal. Iqbal, welcome to the podcast. Really excited to have you over here.
Thank you so much, Anirudh. I'm excited as well.
Iqbal, tell us a little bit about your background and what influenced or inspired you to get into home healthcare. Was that your ambition when you started your career, or you just landed up later?
Yeah, no, that's a great question. I always want to do something on my own, something innovative, something different. And my mom's a healthcare professional. She's a physician, and I see all the great things she does. And she works for a safety net hospital in Chicagoland. Watching her, whether doesn't matter if it's rain, wind, or in Chicago, we have major snowstorms. She's on the Kennedy Expressway. If you're familiar, in Chicago is one of the worst expressways and in Chicagoland, and you have to beat the traffic. And she's on the expressway at 6 a.m. in the morning. And one day I was in high school. I seen her my whole life leave at this exact same time. And one day I was sick in high school, and I told my mom, like, Mom, where are you going? It's early morning and you're not feeling well. You think you caught my sickness and you're getting sick. And she's Berta, she calls me Berta, right? Because that's how we see in our language. She said, um, there's people that scheduled an appointment with me today that took two buses and a train to get here. And I don't want them to come to the hospital clinic only to find out that they have to take that two buses and a train back to where they came from, back home. And that's what I've witnessed my whole life. And this passion for care and this passion for research. And my dad is on the administrative side of things. And he said, Berta, he'd say that if you healthcare is a growing field, I think home healthcare is this field that you might want to look into. And after college, he helped me understand what home healthcare is because he worked in home health. And that's when I acquired a home healthcare organization in 2012.
So a lot is being talked about this concept of home healthcare. What exactly are you doing, and is it different from how different is it from the conventional healthcare? And what gaps do you identify in that as well? In both, I would say, home as well as
Absolutely.
conventional. Yeah.
Yeah, a conventional, traditional home healthcare organization, the way they operate, the way they work is that a patient comes out of the hospital, a patient is in the hospital bed, and they say, and the physician comes to the hospital bed and says, you could go home, but you need supervision, and you don't qualify for a skilled nursing facility, but you could go home, but you need some sort of supervision to help you get back on track. And so that's where home health would come in. So that physician will tell the patient, you could go home with the home healthcare organization. It's short-term rehabilitation in 60 days or less or more. Our goal is for you to leave the hospital and get back to what you do in the comfort of your own home, as opposed to going to a facility. And that's the best place to recover is at home. So that's the traditional conventional model. What we do as an organization, we hit a home run with the traditional model. We work with the hospitals, we work with the clinics. We also work with health plans, the insurance companies, and we help them identify gaps. And through the insights our clinicians are identifying inside the patient's homes, and help them find opportunities to close the financial gap, improve their quality, and at the same time improve the health of the patient. And it's a win-win for the patient. It's a win for us. It's a win for the health plan, but it's a win-win for the patient because they win twice.
Yeah, how is thanks for explaining that, but I would just like to understand on the patient adoption part of it, like how easily is it for a patient to adopt it, and what's the landscape like? Is it growing, or is it like, how is it in Chicago, or do you plan to expand? But right now, how do you see the patient acceptance landscape in this?
Yeah. So that's a great question. Oftentimes it's people identify home health care as a choice in their most vulnerable state. So they're in a hospital bed or they're in a medical office and with a primary care physician and they need to get better. Otherwise, they're going to start going to another level of a deeper state of their diagnosis. And that's where they need some sort of intervention. So people are able to access home health care when they're in a position of vulnerability. And most people are not using home health proactively. We do
That's
get,
where I came from, because even though it appears to be like something that needs to be there, I don't see that acceptance like that much evolve. Like I think there's a lot of untapped potential in that. What do you think?
I agree. And one of the things that we learned one thing we've learned throughout our journey in the past since 2012 is that people are not playing to lose anymore.
Right.
People are playing to win. That's a difference. And when I mean by playing not to lose, it means that there's a concept called aging in place, and that's preventing a person from getting worse. And that's where our clinicians are very intelligent. We work collaboratively with the clinicians to identify these insights. People are the way the healthcare environment is utilizing us is exactly precisely what you said, Mr. Anirudh, is that to help people not get worse. But we're seeing a discrepancy between what the industry is saying and what the way we're being used and the way patients are starting to evolve. After the pandemic, we're seeing more and more people playing to win, and that they want to add more years to the life and life to their years. And they're being more proactive to their health plan, more invested in themselves as opposed to being reactive. That's something that we're seeing, and that's something that we're training our clinicians on.
And what are the cost implications for the patients? You did mention insurances are covered, but how is that getting? How can a patient get the best benefit of it, this service?
Absolutely. That's a great question, Shannon. This is the inside joke of, not inside joke, but in a little bit of an insight of what we say in the industry is the next blockbuster drug. The next blockbuster drug isn't GLP-6 or another thing that I can't really remember right now, Ozempic or whatnot. The next blockbuster drug is patient engagement. Patient engagement is the blockbuster drug that we're all waiting for. And there's no magic silver bullet that can do it. No Merck or Johnson can make that or manufacture that. And everyone's a bit different. That's where our clinicians will come in. We'll work with the patient. We'll help coach them. We'll understand what their goals in the come from their environment and help them achieve those goals and help them get back to where they need to be. And that's one of the core fundamental principles. And we do it better than anyone else in the marketplace. And it shows because of the way people utilize our services and ask for us at the point of care, the point of contact. And yeah, and so that's how most organizations and most individuals are utilizing our home healthcare services.
Absolutely. That's where I was coming to. Maybe you can briefly explain what exactly is BHHN providing and how is it different from your competitors?
Great question. We work with the health plans, and that's one of the big things that distinguish us. And we work to identify gaps in the marketplace. So, for example, in 2012, for the first time in when I first started to purchase the company, the biggest thing that happened was healthcare reform. Healthcare reform, it was the first time in America's history that someone underneath the age of 65 can have an insurance card, go to the hospital and get cared for, go to primary care. And we learned from the lessons of Boston, Massachusetts, before the healthcare reform was passed and started being implemented in Illinois, our state. And what we learned from Massachusetts was the first wave of people that get this card in their hands is going to go to the ER first thing to get cared for. And there's going to be influx of ER utilization. Now, when healthcare reform, and where are they going to go after the ER? Where are they going to go after going to the hospital? They're going to go to home health care right after that because there's not enough capacity for the skilled nursing facilities. They're going to go to a cost-effective care model, which is home health care. And at that time, the state of Illinois was paying lower than the reimbursement, the labor cost of a home health care model. Now, while that's happening, while the hospitals are struggling to find a home health care agency, home health care is being paid less than the labor costs in what we're in the Medicaid world, reimbursement world. What's happening in our office is we're getting a lot of phone calls of individuals, kids, daughters, sons of parents saying, listen, I know it's a financial model. I know it's business. I know it's money. can you please take care of our parents? Can you please take care of our parents? And we'd say, of course, we're going to say yes. We're not going to say no. But the fact that they're asking this question the way that they did and the way they framed it told me that they've received a lot of no's first from a lot of different organizations before us. And that's because it was a business model decision from many home healthcare agencies. And what we take pride in is the two words that's attached to our logo, and that's patient safety first. Three words, I should say, patient safety first. Now, patient safety is preventing preventable medical errors, and our goal is to prevent preventable medical errors. So we said yes to many of the patients. And simultaneously, we're working with the health plans to let them know that, hey, listen, you're going to pay, you're going to spend a lot more money in readmissions. You're going to spend a lot more money on the cost curve for individuals increasing because you're not paying attention to this segment of the marketplace. And when we talk to them, many of the health plans wanted to utilize us and save money, not only the traditional metrics that was being governed at that time, but things that but other things like medication costs and more. And when they partnered with us, and so by doing so, we became exclusive for many health plans. And by being exclusive and being the top partners of many of these health plans, what we found out is that we addressed a very important need for a patient population that just at one point in 2011 didn't have any health insurance, but then 2012 they have health insurance. We address that gap and we address that model. So that's how we are different than a traditional home health care organization that works transactionally. We work to help develop a model of care with the healthcare organization, whether it may be a health plan or a healthcare organization. We work together collaboratively to help them achieve their goals. And when we work with that other collaborating healthcare organization, the patient wins.
Absolutely, yeah. Iqbal, I think BHHN is doing a great job, okay, and for the patients. And really, I think this is something new that more patients should get access to is a priority. But what I want to understand is I want to go a little backwards, a little back, and look at your startup journey, okay? You had an amazing idea. You had an amazing strategy in mind, everything, but the actual thing is materializing your dream, implementing it on the ground. Maybe if you can walk us through that journey, after getting the idea, how did you get it on the ground? What challenges you faced and what have you learned?
Absolutely. Good question. I briefly discussed some of the startup journey with the healthcare reform because I got in the moment the organization started running on its own. Those were the more earlier calls. We came at a time where healthcare was more accessible and for more and more people. So we got a lot of, so we, right off the bat, we solved the problem and allowed the patients to win. It took a lot of courage. It took a lot of crunching numbers. It took a lot of interviewing and putting things together to understand what the cost is for both the patient and the organizations that we partner with. But at the end of the day, it's all underneath the umbrella of patient safety first. That's the most important thing about our organization. That's really what defines our startup journey, our journey through the pandemic, and the journey that we're going to take the next 10, 15, 20 years from now is patient safety. How do you prevent preventable medical errors? Now, where did those two, three words come from? That's before the startup journey. I had a class in my MBA called Patient Safety, and Professor Barbara Youngsberg was our professor, and she told us about this study by the IOM, Institute of Medicine, in a book called To Err is to Human. And things that are written in that book is scarier than a Stephen King novel, I'll tell you that much. But one of the most scariest fact in that whole book gives me chills even just to talk about it right now and to talk about anytime I bring it up, is the fact that they said in 1999 that if I told you that an airplane were to malfunction in midair or blow up in midair and it was on the news every day, would you trust the aviation industry? Every rational person, Mr. Naniro, is going to tell you, no, no, I would not take an airlines if one malfunctioned midair and blew up or lives were lost. And then they turned around and said, what if I told you? That's how the healthcare industry is like. And so that's that gave him a lot of chills. And patient safety is everyone's responsibility. It's the organization's responsibility, healthcare organization's responsibility, it's the people involved in the organization, but most importantly, and just as important is the patient themselves to advocate for themselves but it's ultimately the health organization's responsibility. So our startup journey started with that class and with those two words in mind, patient
And how
safety.
easy was the fundraising part? Yeah, if you can tell us a little bit more about that.
Oh yeah, absolutely. Because it was a acquisition, because it was an acquisition, we already had a little bit of a sales model already implemented. We just had to go run that, and that helped us grow the organization slowly, but yeah,
Awesome.
as we're getting calls from patients.
So now let's look at BHHN in numbers. Okay. How much, like, how do you look at your success? Like how many patients reached, or how do you guys reach out to your patients? Is it directly or through organizations? And how many have you reached, and what's your plan for the next 5, 10 years?
Great question. So the way a home health care agency like ourselves are able to, as they say in the finance world or outside the healthcare industry, customer acquisition. It's the way that we acquire a customer, for lack of a better term, is through those moments where a patient is in the hospital bed or in the physician office, and they say, "Hey, you know what? We need physician identifies that the patient needs home healthcare services. They need a healthcare resource to go inside their home and help stabilize their condition. That's how that works. And our laws in the United States give patients choice. So hospitals is supposed to give them a list of choices. And because and if they're in a certain health plan, we'll be top of that list. And we'll be the recommended organization because we work better and more collaboratively, more intentionally with that organization. Now, the second half of your question, which was sorry, if you could repeat the second half of your
The
question.
numbers, like how many patients have you touched so far, and what's your plan for the next 5, 10 years? Or
Yeah,
how do you rate your KPIs? Do you look at it from number of patients or revenue, or like how do you look at that?
got it. Good question. We like to see growth by how much we do for an organization. How many organizations we partnered with? To us, that's more important because when we partner with an organization, that allows us to use our innovative thinking and our skill sets that we already have. We can grow. Most organizations don't have that institutionalized knowledge to work collaboratively with the organization, help them get from point A to point B through a life cycle of point A to point B. So for us, we want health organizations to take advantage of things that we're capable of doing that they're not aware of. And we're seeing more people recognize that and say, hey, you know what? That's the organization that can work with us more collaboratively and do things outside the traditional
Right.
relationship that our organizations typically works with. We could do a little bit more than what is asked for. So that's how our organization sees growth is to have more partners and onboard more collaborative partners year over year. Because when we do good work, success follows, the revenue follows.
How many organizations are you working with I think only in Chicago, right? Area.
Yeah, we're working in Chicago. I don't want to disclose that because those
That's it.
relationships are
That's fine. That's it. Just that's it.
yeah.
And do you
But
plan to expand to other cities as well?
yes, we do plan on expanding to other cities, but not through transactional mechanisms. We want to help governments to help them unlock the value they're trying to unlock, whether it's Canada or Ireland or whether it's someone in the States such as Florida, West Virginia, Connecticut. I'm just name dropping names of states. Those are some of the things that's how we want to grow. We want to grow through solving a problem, helping those organizations get to or governments get to where they want to be from point A to point B, help them actualize the cost savings and improve the health quality of their patient population. And we prophesize that in the next 5 to 10 years, we're going to be saving the state of Illinois $100 million year over year. That's what we prophesize. And when we start working with them more collaboratively, when they want to work collaboratively more with us.
Nice. Just for my understanding, how do you calculate that 100 million? Like,
Yeah, no, absolutely. It's a great question. It's just I don't have a chalkboard
I thought I
to
was like,
talk to everything, but
I'm
at a
just
high level,
for a layman like me.
yeah, no, absolutely, yeah, at a high level, we have based on public data and assumptions that we have within the organization and what we've seen in the marketplace when our institutionalized knowledge and experience that we know that we can make the state of Illinois healthcare department a little bit more efficient and more effective in delivering healthcare services. We see opportunities every day with our clinicians inside the patient's homes, collecting insights that are outside of what's standard. And when we put that together, it adds up to $100 million.
All right, all right, all right. So let's just talk a little bit more on a holistic topic, and that is entrepreneurship in general. Of course, we're focusing on home healthcare network and all, but a lot of our viewers could be like budding entrepreneurs or those who are planning to take that step. So, what guidance can you give them? Of course, the first guidance is don't step into my territory. But apart from home healthcare network, if they want to get into med tech or devices or something related, like what guidance do you give from your own experience?
Yeah, first of all, it's always welcome to have more competitors that you want to compete with. And that brings out the best. If you look at any athletic sports or whatnot, the best matches are the ones where both competitors push each other. And that's how it elevates the standard of that sports organization, whether it's soccer, basketball, golf, whatever it is. So it's welcome to have more competitors that allow us to get the best out of each other. And in healthcare, everyone wins when that happens. So that's a good thing. I don't have that many competitors that think like us, or if any, the feedback I get from the community in healthcare is that no one thinks like us. No one has processes like we do. No one executes excellently like we do. We're the excellence of execution. So we get that a lot of feedback from people that we work with. Now, when it comes to advice for growing entrepreneurs, there's a lot of advice, but be courageous. It's going to be a lot of tough times you're going to face. Make sure you take care of yourself. Make sure you invest time in yourself as well as the organization. Because when you take care of yourself, you can take care of everyone else. That's probably an advice that I would, if there's one advice you could take away, it'd probably be that. Take care of yourself, and that way you can take care of others.
And Iqbal, before we close out, maybe one mistake from your entrepreneurial journey which will tell others to avoid.
It's you want to make mistakes. Mistakes help you grow. And it's about knowing the that whether you learn from the mistake is important as well. But sometimes running to the same mistake over and over again until you get to the answer to the bottom of it is important. So I think I wouldn't say this is a mistake, but I think that for me, and I think a lot of people, we fall into a rabbit hole and go deeper and deeper, and which is in some aspects fine, but knowing when to take a step back and say, hey, let me go back to the big picture and see if I'm going the direction the big picture's telling me to go to, and say reroute if I have to, or continue to dig deeper. Mistakes are welcome. Don't be afraid to make mistakes. You're gonna make mistakes, just as long as you learn from it. And if you're making the same mistake over and over again, as long as you know that you're going to get to, it's a matter of perfection. You get mistakes that lead to perfection, that's fine. And that's all I could say is it's going to take a lot of courage. It's unknown territories, a lot of uncertainty. If you love uncertainty, go for it. And I think the best way to think about entrepreneurship is rock climbing. I've climbed a mountain before, and one time I was stuck. And I was stuck, and the guy was like, "You need help? You need guidance on how to maneuver this place?" And I'm like,
Well,
"Let me figure." Yeah, I looked down. I was like, "Let me figure it out." I'm speaking as
where was this?
this was like last summer. So
Where?
this is in the United States.
Okay.
Yeah, so we climbed the mountain, and my wife and I was stuck, and my wife didn't climb the mountain; she didn't want to. But I climbed the mountain, and I was stuck, and I realized I can't I see the finish line, and you just have to use what's available around you. So you have to say, okay, can this work? Can this work? Do I have to contort my body in a different way? But you have to use whatever options available to you in the vicinity that you have, and you make it work. Sometimes you'll fail and you'll fall, but I didn't fall, even though I had a harness. I didn't fall. I didn't want to fall, even though I had a harness, but I wanted to see if I could do this myself. So it took some trying and trying different ways to till I can contort my body in a way where I can progress moving up. So you're always gonna get stuck. Every rock climber gets stuck. And it's just a matter of seeing different angles differently to climb up the mountain. So the rock walls. I think that's the best symbolism I can offer, or any advice I could offer that symbolizes the journey of being an entrepreneur. Is rock climb. Just rock climb outside on a natural wall, and you'll get a better understanding. You're gonna go through fear. You're gonna have to go down. You have to go up. Sometimes you have to go down to get back up. And you sometimes some options that are there you didn't think it was going to be an option. But that's an option to go up. And when we're on the bottom and you say, hey, this is how I'm going to go up. This is my path. You quickly realize that's not going to be the path. It looks like it from down there, but it's not. But you still get to the top. But sometimes you look at the wall, you're like, man, I'm not going to make it. But one of the advice that my fellow the rock climber, pro rock climber was telling me is that just look at checkpoints. Look, you see that ledge, try to get to that. When you get to there, think about the next checkpoint in your head and just keep going and going. So I think rock climbing is a great way I'd encourage every entrepreneur to do rock climbing, and just as every so often, just as a reminder of what entrepreneurship truly is, and it resets your body. So yeah.
Absolutely. Iqbal, this was a fantastic conversation. And of course, apart from your rock climbing story, what stood out to me is that home healthcare is no longer just a supplemental service, it's becoming an essential part of how healthcare is evolving, delivered, and experienced as well. And just love the things that BHHN is doing. And I really wish you all the best to scale it up further and reach out to as many patients as possible. And thank you again for joining me over here.
Thanks so much, Benito. I appreciate your time and I appreciate being on this podcast.